To begin assembly, check that the arrow on the plastic spool of the handle unit is aligned with the arrow on the bracket. It is recommended that a diagnostic gastroscope is used. Also, a rubber grommet with the lid open. To facilitate assembly, straighten out the endoscope before you begin. Begin assembly by inserting the distal end of the tripwire through the biopsy valve and then the working channel of the endoscope. Continue feeding the tripwire until the wire loop exits the distal end of the endoscope. Then, firmly install the biopsy valve onto the stem of the handle unit. Install the handle unit into the biopsy opening of the endoscope by wrapping the scope fastener around the endoscope and locking it into place. Attach the pulling loop of the ligating unit to the wire loop connector on the distal end of the tripwire by threading the pulling loop through the tripwire loop, then threading the ligating unit through the pulling loop. Next, you will attach the Super 7 multiple band ligating cap to the endoscope. Take up the slack by pulling the proximal end of the tripwire on the handle unit. The pulling loop of the ligating unit will advance into the working channel of the endoscope. Stop pulling on the tripwire when the soft proximal end of the ligating unit cylinder contacts the distal tip of the endoscope. Notice that there is a black stripe on one side of the ligating unit. Line up the black stripe on the ligating unit with the working channel of the endoscope and slide the ligating unit over the distal end of the scope using a gentle rocking motion. Next, gently pull up on the tripwire to take up the rest of the slack. Stop applying tension when resistance occurs. Now, secure the tripwire in the slot on the handle unit. To remove the ligating unit shrink wrapping, simply grasp the red tab and pull. Then, peel off the protective plastic wrap. Be sure to emphasize to customers that the shrink wrapping must be carefully removed by hand. They should not use scissors or other instruments, as this may disturb the bands and tripwire and negatively affect deployment performance. If irrigation is desired, attach a syringe or the irrigation tube provided. A sterile syringe is not required. The Super 7 multiple band ligator would now be ready for use.